Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. It was recently shared in a GTA newspaper column that COVID-19 reports are now somewhat like speaking about the weather. It's hard to say something new, but we still need to know about changing conditions so we can be prepared and respond. But in fact, there are new developments with COVID-19 and our response each and every hour, every day, and every week. So I look forward to continuing to share these updates with you. COVID-19 transmission is still very high in the community due to the Omicron BA2 variant, but we continue to see stabilizing signals in our wastewater data. The status in most areas of the province is showing a similar plateau, and we are hopeful that it will soon show a steady decrease. The number of patients in York Region hospitals and across the province is still very high, but not increasing as steeply as it had been previously. Our institutional outbreaks are high, but stable as well, and test positivity is declining somewhat. These are all signs that we are heading in the right direction, but that the pandemic and its impacts are not over yet. In particular, we all need to take action collectively to keep ourselves well, but also to prevent infection among those who might become ill enough to need hospital care. Last week, York Region's state of emergency was lifted, and the provincial measures under the Reopening Ontario Act came to an end. Masking is still strongly recommended in all indoor settings, but masks are only still required in transit, healthcare, and select other congregate settings. These developments are all positive and hopeful and are a product of our ongoing vaccination efforts and measures that York Region citizens now voluntarily adhere to protect themselves, loved ones, and neighbors. Even if you choose not to wear a mask in all settings at all times, please do keep one with you in case you are in the three C's: crowds, close contact, or confined spaces, or if you may be near an older or vulnerable person. We've had tremendous turnout in York Region for those eager to protect themselves by getting their fourth dose. Over 30,000 fourth doses have been administered to York Region residents 60 years of age and older. The fourth dose is particularly important for those over 70 and 80, so we strongly encourage older York Region residents to get their second booster as soon as possible. Anyone above age 12 should now have 3 doses, and children aged 5 to 11 should have 2 doses. I've had many people continuing to ask recently, do I need a booster or a second booster if I've had COVID? And the answer is most certainly yes. The protection provided by the vaccine is longer lasting and better than having COVID-19 disease, and it's also far safer. If you haven't received your fourth dose, please make an appointment by visiting york.ca/COVID-19 vaccine or calling Access York at 1-877-464-9675. If you're still in need of your first, second, or third dose, you can walk into any of our York Region public health clinics, and if you're in this position, I encourage you to do so right away. With warmer weather comes time spent outdoors, where it's much safer to gather compared to indoors in close quarters. Please continue to stay safe as we head into the summer months. Programs and services that were previously suspended over the past 2 years, while we focused on the pandemic, are slowly resuming over the coming weeks and months. Let's continue to work together to do our best to prevent further transmission, and please remember to stay home if you're ill, wear a mask when necessary, and get vaccinated.